All right, well, thank you so much, everyone, for joining us today. Thank you to all our workers and healthcare professionals who are willing to share their stories and speak to their experiences. My name is Katie Baker. I'm here today on behalf of Americans for Good Policy to moderate this conversation to really elevate why Virginia needs to pass paid sick days legislation. And one thing I've noticed anecdotally that I think would probably be backed up by polling is a lot of Virginians aren't aware that Virginia does not have any kind of law guaranteeing paid sick days. I've noticed that in conversations with people, like, oh, don't we already have that? But in fact, more than 1.2 million workers do not have a single paid sick day off a year, including 41% of workers in the private sector. So we're really just trying to elevate this issue, particularly as an affordability issue, because if you're sick, you have to make a really difficult decision. Do I give up my pay for the whole day and stay home and try to get better? Or do I go to work, spread my sickness to my coworkers, and only operate at half capacity anyway? Because I think we've all been there where we're not feeling 100%, but are trying to power through anyway. So with that, I'm going to turn it over to our partner at Virginia Interfaith Center for Public Policy, who has been really at the forefront of this fight for paid sick days for years. I remember working with them back in 2021 on Delegate Guzman's paid sick days bill and ended up being able to secure some paid sick days for home care workers. But really excited to introduce Ramon Zepeda Ramos, who is the economic justice organizer and policy expert at Virginia Interfaith. Ramon.
Thank you, Katie. Good morning, everyone. Again, I'm Ramon Zepeda Ramos, Economic Justice Organizer with the Virginia Interfaith Center for Public Policy. It's a pleasure to be here and share this space with everyone. Real quick, just want to give a little bit of background. Virginia Interfaith Center for Public Policy works with people of faith and goodwill to advance justice, equity, and the common good across the Commonwealth. And we represent different faith traditions, but also people that just care about social justice. This is my second year working on paid sick days, but we've been advocating for this, working with other organizations and advocates since 2018. And it is our faith that brings us here. We care about everyone, especially working families. I think having access to paid sick days would help families tremendously, especially because right now, 41% of the private sector, 1.2 million workers, have to make a difficult choice when they get sick. Do they get paid, or do they stay home and take care of themselves and their loved ones and not make any money? And we know that that creates a crisis, because losing work and not getting paid means that they also cannot afford groceries or pay the rent or things like that. So we think that this will really tremendously benefit working families, low-wage workers. In 2021, the paid sick days law that passed only covers 30,000 home healthcare workers, but it's still needed for many, many Virginians, many workers who don't have that benefit. And last year we got really close. Our legislators passed a paid sick days bill that unfortunately got vetoed. We hope that this year brings a new hope, but we still got to continue to advocate for it. In the end, we want to make sure that all workers in Virginia have access to a few paid sick days, and this is a modest standard that would give the workers an opportunity to earn paid sick leave. They would have to work to earn accrue paid sick leave, and up to 5 days a year. Of course, employers can give more, and I know that there are a lot of good employers already. I work for an organization that provides paid sick leave, but without a standard, there's also some employers, maybe bad actors, that not only do not provide paid sick leave, but that might have punitive policies that punish workers when they get sick and don't show up to work. So I think having a modest standard is something that we continue to advocate for. It's going to help a lot of people. It's going to help our economy. It's going to keep workers safe, and it's going to help workers be able to pay for the necessities. So with that, I'll just pass it back to Katie for a second.
Thank you so much, Ramon. Just really excited to be working with you all. We actually did have a home care worker. Our friend Jeannie Robinson from SAIU wanted to be here today to share her paid sick day story. Unfortunately, her parking lot was a sheet of ice, but I'm sure if reporters are interested in connecting with her at another time, she would be happy to. But really grateful to Miss Jeannie from SEIU. And next, we'll turn it over to Latavia Lowe, who is a behavioral health clinician from Richmond. Latavia.
Thank you, Katie. Good morning. My name is Latavia Lowe. I am a behavior support clinician with Compass Behavioral Group. So essentially my job is to provide in-home and clinic therapy to children with autism. So with that, illness is one of those things that no matter how many precautions you take, it's kind of inevitable that you're going to come across it. And my role at Compass exceedingly relies on me being physically present. On a daily basis, I'm coming in contact with 1, 2, sometimes 3 different families, also coworkers, supervisors, and especially clients who attend public education as well as their siblings. So this automatically increases my threshold for potentially becoming ill. But on the contrary, I only get 1 bank of PTO, and that consists of 5 accrued hours per month, with the stipulation that I meet the full-time requirement of 105 hours in a month, which from personal account is way harder than it sounds to achieve. That PTO has to get allocated between sick time, as well as client cancellations, clinician cancellations, inclement weather, and then whatever other unforeseen circumstances may occur. This ends up placing an undue amount of stress onto my shoulders because I'm faced with the reality of knowingly putting myself and others' health in jeopardy, or being faced with the fact that I might not be able to put food on my table, gas in my car, lights over my head. I hate to admit that I've gone to work while battling illness, especially considering myself. I suffer from lifelong chronic asthma, and a lot of the populations that we serve also have their own physical vulnerabilities that they face. But unfortunately, some supervisors will still continue to encourage attendance just for the sake of service continuity. However, my job isn't just showing up. I'm providing a medical service at the end of the day, but I can't properly commit to my job responsibilities if my own health isn't at capacity to do so. This is a company that prides itself in compassion and empathy for its workers and others. Yet in my 8 months of experience, I don't feel like they've truthfully upheld this standard. When we bring these issues to light, we're usually met with the typical, "I hear you." But if that were truly a fact of matter, I wouldn't be here speaking today. I usually have to, on top of, long hours, being in client homes, I drive from house to house, clinic to house, house to clinic. But when I'm faced with the matter of, not going to work, and it puts me in the place where I have to, do outside jobs. I DoorDash on top of all of the hours that I work. Mm-hmm. And it's just, for my own physical sake, it's not that conducive for me. And I want to be able to be present, be my full self to help out my clients. And that's what's most important to me. Yeah, thank you. I'm going to pass that back to Katie.
Yeah, thank you so much, Latavia. And I think that your remarks really speak to the importance of actually passing legislation, because not all employers are going to be good employers, as Ramon has, who are going to offer paid sick days for their workers. And next, we will have Lachey Kelly Talaferro, who came up from Carrollton today.
Yes.
Who is a grocery store worker. We're happy to have you, Lachey.
Thank you, Katie. Again, my name is Lachey Kelly Talaferro. I am with UFCW Local 400. I myself have lived the life of not having sick days. About 5 or 6 years ago, I had a husband who was diagnosed with congestive heart failure at 32. He was sent to Duke University. I worked in Smithfield. It takes me like 3 or 4 hours. I was getting phone calls after phone calls, trying to maneuver 3 kids, take care of a house, 2 jobs, going up and down the street with him, just to make sure he's fine and taking care of the kids. I didn't have any sick days. Of course, the grocery store did not allow that. I was forced at the beginning to choose between my job and my family. And you're talking about bills that were coming in, a heart transplant that was needed that was $1 million. You're talking about medication that was $30,000 a month. I mean, it was just bills adding up, adding up. And for a worker to have to sit and choose whether or not they need to go to work or whether they need to go see their husband is astronomical. There's no way that anyone should have to choose between their job and taking care of their family. A lot of our workers that we have in the grocery store, there was another scenario that I just want to piggyback on. There was a 6-month-old child who was sick, had seizures, epilepsy. Father was the sole keeper of the child. Could not be there with the child because he had to work. Now you're thinking, how can a worker succeed in his job if he's not able to take off time to go see that child? I mean, at this point, I think that everyone needs to understand everyone gets sick, not just for us as a worker, for us as a family. I mean, I have 3 boys, 16, 12, 7, bring home the flu, the whole house have it. I mean, they wrestle, they play football, so, germs are there. And we can't help, that things happen, but sick days are needed as a family.
Thanks so much. And, your story reminds me of another point I wanted to make, that there's actually 2 proposals out there and we need both. So one is paid sick days, so that if you get the cold or the flu or your child is sick and has to stay home from school and you need to take care of them, you're able to take that day off. And then we also need paid family and medical leave for a situation where
Yes.
you had a very sick husband and needed a longer
Right.
period off,
Right.
which would allow people to take, I think, up to 12 weeks off at a certain percentage of their pay to ensure not only is your job protected, but that you have income and can continue to afford to live while you're taking care of a sick family
And
member.
I do want to add that if it had not been for my local union stepping in to fight for the cause, then I would not have had a job at all. And I would not have been able to go see my husband at that point of time as well.
And that actually reminds me, I do want to shout out, I see lots of my union brothers and sisters, siblings out there. I know we've got Teamsters, UFCW, I see Miss Julia from SEIU, IBEW, I think Evan is from SMART is out there. Am I missing anybody? Just happy to have, I think Emily's also a campus worker, so just happy to have all my union brothers and sisters at an event like this. It means a lot. Next, we're gonna go ahead and turn it over to Evan. I'm gonna turn it over to Evan Hargreaves, and you are from Richmond.
Yeah, well, thank you, Katie. Like you said, my name is Evan Hargreaves. I've been a member of the IBEW Local 666 since September 2024. I'm currently a second-year apprentice at the Richmond JATC, and most recently worked for Tatum Hill. And I'm just here to talk today about how having some guaranteed sick leave would have a significant positive effect on the quality of life of IBEW members. Currently, electricians in Local 666 do not get any paid sick days, so every day we miss while sick comes out of our paycheck, as we are hourly employees. This is a big deal, as many of our members, especially our apprentices, are only 1 or 2 paychecks away from falling behind on their bills. This lack of sick days puts members in a situation where they either have to keep coming in and risk getting others sick, or put themselves in a sticky financial situation. While it didn't happen while I was working under the IBEW, I've been personally affected by not having sick leave in the past. In 2023, I worked at Edo's Squid and had no paid sick days. I got sick with COVID-19 and missed over a week of work, and because of that, I had to reach out to my landlord and tell them that I was going to be late on rent. Luckily, they were agreeable about that, but not everybody will be in that situation. I've known many other coworkers over the years that have chosen to work while barely having the energy to stand because they couldn't afford to miss work. And this is just not how things should be. In essence, I don't think people should be forced to choose between working through illness or losing money on their check that in many cases they desperately need. Businesses can afford to take care of their employees for a few sick days a year, and since they refuse to do it of their own accord, it's necessary that the legislature pass paid sick days legislation this year. Thank you for your time, and back to you, Katie.
Thank you so much for sharing your story, Evan, and I'm sorry you had to experience that, where you're choosing between paying rent and staying home when you have COVID. Look, we've all been in workplaces where we've had a coworker, oftentimes a beloved coworker, who's hacking right next to us and are worried about what sort of germs are percolating in the room. The General Assembly building itself is a bit of a petri dish, as I think a lot of us have experienced. So I really wanted to bring in the voice of a healthcare professional, Dr. David Clark from Hanover County, to talk a little bit about the public health ramifications of what happens when workers don't have paid sick days. Doctor.
Thanks. I'm David Clark. I'm a licensed physician in Virginia for over 45 years. Worked mainly in emergency rooms and family medicine. And I may come as a shock to you, but I try not to give advice. And that's because patients aren't going to follow my advice anyway. They're going to do what they want to do. But when I see somebody sick come to my office or the emergency room, we always provide them with a note, getting them off work for however many days we feel is appropriate. And I can't tell you how many times the patient says, well, you can give me that, but I'm not going to use that note because I really need the money. I can't afford to stay home. And that's a huge public health risk. Because if you're sick, shedding viruses, you don't want to be around your coworkers because somebody else is going to get sick, and then it's going to just expand logarithmically, which means a lot. And if they had something to fall back on, like knowing they had sick days where they really didn't feel like going to work, but they can stay home and get paid anyway, I don't think they're going to abuse it. Most people want to work, with a few exceptions, I'm sure. But this kind of legislation is exactly what's needed to ensure that we don't have the spread of contagious diseases in the population.
Thank you so much, Doctor. Just really appreciate your remarks and your being here today to speak from that public health angle. And I think we have time for one or two discussion questions for the group. So the first one, I'm just sort of curious, do your family and friends all have paid sick days? Do they not have paid sick days? Are they aware that people don't have paid sick days? Anybody want to jump in, Lachey?
No, they don't have paid sick days.
Mm-hmm.
A lot of them, like in the grocery stores, workers, construction workers, they don't get paid sick days. A lot of them out there with the mask on and the whole shebang, still sick, still flagging, still not feeling well. So they don't provide sick. They barely pay vacation time sometimes. So it just depends on the company.
Anybody else will jump in?
Yeah, having worked in 3 different industries as an adult, in restaurants, as a truck driver, and now as an electrician, I've never had paid sick leave. So like most of the people I know in my life that I've made friends with along the way have never had paid sick leave either, and it's definitely negatively affected them.
I mean, I currently, like I mentioned before, I do work for an employer that provides paid sick leave, but I have my first job when I moved to Virginia was also in the private sector for a company, and I did not have paid sick days, paid sick leave. I also have my parent of 2, so I did have to make that choice many times of not going to work because I had to take care of myself or my loved ones, my kids. But my coworkers also did not have paid sick days, paid sick leave. The people that I know mostly that work in low wage jobs are typically the ones that don't have those benefits. I did work to like get an education and I can apply to jobs like where I work now in a nonprofit, but I know most of my friends and family members here in Virginia and North Carolina and many parts of the country that work in factory jobs, low wage jobs, don't get those benefits. So I think having a standard is really important.
Same here for me. Many of my friends, coworkers, the past jobs that I've had, I've worked at a private preschool, and even with the thousands and thousands of dollars that they receive in tuition, I'm on the front lines of germ sickness. I work in the toddler room. I work with babies. I've had laryngitis, streptococcal, the flu at the same time. Never once have I ever been offered sick pay. I've come to work and they have only sent me home only because they could physically see that I was unable to be there.
Wow. All right. Well, since I think we need to be out of the room at 11, I want to thank everybody for sharing your stories, for having this conversation. Thank you for the flexibility on the reservation time changing. We do still have a few minutes before we have to get out, so I do want to invite people to grab a bagel, and I think we have at least one reporter here. So Charlotte, if there's anybody you want to talk to, I think we can probably facilitate that and answer any questions. And just thank you again to all of our speakers. I also wanted to recognize Reverend Dr. Lakeisha Cook, who leads Interfaith, for just being such an incredible partner and having really been on the forefront of the paid sick days fight for so many years. Thank you. All right, thank you, everybody.
Thank you so much for